I'm going to perform hand hygiene. Knock, 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 might come in. Hi, my name is Emma. Today I'll be your student in today. May I see your ID badge? Hi, Mr. Smith. Today I'm going to be doing mouth care on you. Is that okay with you? But before we get started, I need to go grab my supplies. But first thing that I want to do is to check for safety. In this case, I'm going to check if the bed is locked and if it's at the lowest position. Then I am going to give you your call light and I'll be right back with my supplies. I'm also going to perform hand hygiene before leaving. And my supplies in this skill will be an emesis, a toothbrush, a toothpaste, a towel, a pair of gloves, a bag, and a cup of water. Then I'm going to perform hand hygiene before entering. Knock, knock, might come in. Hi, Mrs. Smith. I am back. We're gonna get started with your mouth care. The first thing that I want to do first is to provide privacy. Then I am gonna put down my supplies. The first thing I'm gonna put down is a barrier so I can have all my supplies on top. Then I'm going to raise the head of the bed up, and I'm also gonna raise a little bit of the bed so it's at least at a working level for me. So I want to do this because I don't want you to prevent from any choking. Then from there I'm going to drape this towel against your chest, and I'm going to put on gloves before actually doing your mouth care. I'm also going to ask you to rinse your mouth with this cup of water that I have, but I already had it ready. So once the resident is rinsing their mouth, I'm going to wet the toothbrush and put a small amount of toothpaste. Okay, Mrs. Smith, we're going to rinse out the water from your mouth. I'm going to use an emesis for that. And I'm going to start brushing. The first thing I'm going to start brushing is the lower and the upper teeth from the inside of the surface, the inside of the mouth. And then I'm going to work with the outer surface of the teeth. So while I am brushing the resident's teeth, I'm also going to check for any swelling, any cracked tooth, basically anything that doesn't look normal. Okay, Mrs. Smith, I'm also going to be brushing the upper and the lower part of the chewing surfaces of your teeth. And then from there, I'm going to gently, I'm going to check if she may need a mouth rinse. In this case, she doesn't need it. So, okay, Mrs. Smith, I'm going to be brushing gently your tongue. Is that okay? Okay, we're going to start brushing your tongue. Okay, now we are done. Now I'm going to hand you again the cup of water for you to rinse your mouth. Then when you're done rinsing, I'm going to put the emesis right underneath your chin. Not underneath, but like right near. And then from there, okay, Mrs. Smith, I'm going to wipe your mouth, and then I'm going to take the towel away from her and put it in the bag. And I'm going to leave Mrs. Smith with the head of the bed up because I don't want her to choke. Okay, Mrs. Smith, I'm going to empty out the emesis, and then after that I'm going to dry it as well. So I have to rinse the emesis as well and then dry. Then I'm going to rinse the toothbrush, and then I'm going to return the toothbrush and toothpaste back where I got it from. And then from there I'm going to take off my gloves, and then I'm going to ask Mrs. Smith, is there anything else that you may need? No? Okay, so I'm going to hand you your call light, and if you need anything you could just you could bring it in. I'm going to also display the trash that I brought in. In this case it would be the towel and the cup of water, and it would be all in the bag. And then I'll cover my hand with a perform hand hygiene covering all surfaces, and then skills complete.